I am J.M.Perez and I'm here to perform assessment of the abdomen. So first in assessment of the abdomen, I need to assemble all of my equipments, which is stethoscope, skin marking pen, and tape measure. So next, I'm going to assess the abdomen of the patient by reading the patient's chart to have a baseline data. And next, I need to perform hand hygiene to avoid cross-contamination. And next, identify the client and introduce myself and explain the procedure that we're going to do so we can build a rapport. Sir, are you J.M.Perez?
Yes.
Good morning, sir. I am J.M.Perez and I am your student nurse for today. I am from Pamantasan ng Lungsod ng Marikina. We're going to assess your abdomen if there is any abnormalities in your bowel movement. Is that okay to you?
It's okay.
And now, after that, tell to the patient if he wants to urinate, he can urinate because an empty bladder is more comfortable for the patient when assessing the abdomen. Sir, you want to take urinate?
No, it's okay.
And if the patient urinated, we can ensure that the temperature of the room is warm because the body of the patient is exposed. Now, provide privacy for the client, closing the curtain, closing the door. And next, after that, we're going to position the client in supine position. And the knee is slightly flexed. And after that, in assessing the abdomen, there is a right pattern. First is inspection, second is auscultation, third is percussion, and fourth is palpation. So, first, I need to inspect the patient's abdomen, the size, symmetry, and the contour of the abdomen of the patient. So, as you can see, the patient's abdomen is slightly scaphoid. After identifying the contour, size, and the symmetry of the patient's abdomen, we're going to tell to the patient that raise her head slightly to check if there is any bulges in the abdomen. So after that, there is no any bulges in the patient's abdomen. After that, check if there is any distension in the patient's body. And if there is any distension, measure the girth from umbilical and place the tape measure in the umbilical. After the patient have no any distensions in the abdomen, and after that, we're going to observe the client abdomen if there is any skin lesions, masses, or stretch mark, wounds like that. And as we can see, the abdomen of the patient don't have any skin lesions. And after that, I need to take note the abdominal movement, note the color of the umbilicus. And now we're going to auscultate the abdomen of the patient. In auscultating the abdomen of the patient, there is a pattern. First is the right lower quadrant, next is the right upper quadrant, next is left upper quadrant, next is left lower quadrant. We are expecting to hear 5 to 30 sounds per minute in the abdomen of the patient using the diaphragm of the stethoscope. Before concluding that there is no bowel movements, we need to auscultate it for 5 minutes. So the bowel movement of the patient's abdomen is normal. And next, after that, we're going to auscultate the arteries of the patient, which is aorta, renal arteries, and iliac arteries of the patient using the bell of the stethoscope. So the aorta is below the scaphoid process of the abdomen. Next is the renal artery of the patient, which is slightly below of the aorta. Both of the renal artery. We're looking for swooshing sound. If there is any swooshing sounds, that means there is bruise or bruises in the patient's arteries. Renal arteries. And the iliac artery. So there is no any swooshing sounds that we hear. So that means there is no bruise or bruises in the patient's abdomen. And next, after that, we're going to percuss the abdomen of the patient. In the every quadrant of the patient's abdomen. Check if there is any tenderness, masses, or muscle resistance. Sir, tell me if there is any pain that you feel. Yes. Are you all right, sir?
Yes.
So, in percussing the abdomen of the patient, there is no any masses, tenderness, or muscle resistance in the abdomen of the patient. And next, we're going to examine the size of the liver, spleen, and the bladder of the patient. So, in examining the size of the liver of the patient, we can use the scratch test. And line it. And after that, usually the liver is measuring in 6 to 12 centimeter. And next, check the spleen, percuss the spleen. Again, line it. Next, we're going to examine the size of the bladder. After examining the size of the liver, spleen, and the bladder, we're going to go now in palpation. So in palpation, there is a pattern too. First is light palpation, next is deep palpation. Light palpation is 1 to 2 centimeter, and deep palpation is 5 to 6 centimeter. Notice there is any tenderness, muscle resistance, or masses. So tell me if you feel pain again.
Okay.
Do you feel any pain? So there is no masses, muscle resistance in the abdomen of the patient. Next, we're going to deep palpate it. Sir, do you feel any pain?
No.
Oh, I see. Next, we're going to, after palpating, there is no any masses or muscle resistance. Now we're going to palpate the liver of the patient. First, position yourself in the right side of the patient. Next, place your right hand in the mid-clavicular and mid-clavicular under, and place your left hand in the patient's back, lower ribs, in the lower back of the patient. Place your right hand here and try to press it, sir. Inhale, exhale, inhale, exhale, inhale, exhale. So there is no any masses or muscle resistance in the patient's liver. Next, we're going to palpate the spleen of the patient. So in palpating the spleen of the patient, we need to put our left hand on the patient's back and the right hand in the patient's in the CVA. Inhale, sir. Exhale. Inhale. Exhale. So again, there is no any masses or muscle resistance in the patient's abdomen. So that's all. Thank you.